Prostate cancer is very treatable if it's caught at an early stage, and that's why screenings are so important. We've got more from insider Dr. Daniel Martinez. Take a look.
So this is a cross-sectional or sagittal view of the actual prostate. So here you have the man's prostate. It's this, looks like an acorn almost organ. You have the seminal vesicles, which come right behind the bladder, which is this portion right here, and then you have the urethra right here, that is where the urine comes out of. So the prostate and seminal vesicles, their main purpose is not to cause cancer or to grow with a man as they get older. It really is meant to create the fuel and the medium where the sperm mixes in with, and so when a man ejaculates, the majority of the fluid actually comes from here and here, not so much the testicles. With time, over time, of course, the prostate can grow, the prostate can develop cancer. There could be a number of other things that can cause issues with these organs.
So how prevalent is prostate cancer?
Well, prostate cancer is actually the most common cancer that a man will get. Second to skin cancer still being the biggest cancer, the most common cancer that men and women both get, but prostate cancer is the most common cancer that a man will get.
And what is the cure rate for prostate cancer?
It's extremely high. So the beautiful part about prostate cancer, and you shouldn't say beautiful when he's talking to cancer, but the great part about prostate cancer is that it is extremely treatable, it is extremely curable. So really the key is screening equals diagnosis equals cure. And that's the importance of Men's Health Month. June is you really should go out there if you're a man and get checked, not only for prostate cancer, but from colon cancer, get your colonoscopies done, check your urine. There's a number of things that men are supposed to be doing in order to make sure that they're healthy.
Thank you, Dr. Martinez. Now, I'd like to take a moment to remind our viewers that if you have a question for the doctor this hour, you can call in. That number is 855-796-4475. Now, besides being male, what are some of the risk factors for prostate cancer?
Some of the risk factors include family history. So the man has a family history. And we're not talking about, oh, my grandfather had prostate cancer at the age of 92. Because if a man lives long enough, if we were to check, they're all going to have prostate cancer because it's a disease of aging. But if your father had prostate cancer at the age of 50-something, your uncle as well, your brother, your grandfather, that really is one of the biggest risk factors. There are certain also ethnicities. We know that African Americans are also a higher risk for prostate cancer. Why? We're not quite sure.
Can you test for a gene that makes you more susceptible to prostate cancer?
At this point, that does not exist, at least not a routine gene that we normally order. The most common screening things that we do include a blood work, which is a PSA, prostate-specific antigen, and a rectal exam. And then I think we're going to be going over that in a little while when you should be starting to do that. But gene-wise, there are some familial links, and there are some genes in breast cancer, for example, the BRCA gene, ovarian cancer. There's certain genetic Lynch syndromes that people can develop some of these cancers with. But prostate cancer, we don't really routinely order anything like that yet.
Okay, we're actually going to go over it right now because when should men start getting screened for prostate cancer?
This is extremely controversial. Many years ago, the U.S. Preventive Task Force got rid of this, and then the American Urologic Association redid this. And so what the current recommendations actually are is if a patient has a family history of prostate cancer, they should start getting screened at approximately 40 years old, okay? If they do not have a family history, then you can start about 45. So those numbers, even those numbers that are up right now are still a little bit off. By 50, every man should have had at least a prostate exam with a digital rectal exam and a PSA. But usually 40 and 45 are the two numbers that I practice and implement in my practice and talk to patients about.
And these are screenings you're getting every year?
Depending on the level of the prostate-specific antigen of the blood work, you can actually do it every other year or every year. And these, again, are the new recommendations provided by the American Urologic Association. Okay,
and now is there an age when a man should stop getting screenings?
Wonderful and also extremely controversial question. We used to screen everybody. You can be a 95-year-old man coming in a wheelchair and they're still getting rectal exams and PSAs, and what we realized is that's probably a little bit too extreme. And so the rule of 10-year life expectancy, once you get to 70 and 75, the conversation should be had between the urologist and the patient or the primary care and the patient. And if the patient is very healthy at 70 and 75 and they have the ability to be able to live for more than 10 years, then sure, why not? Absolutely screen those patients. If they don't, they have a heart disease, they have a lot of other things, and they're more than likely to die from something else eventually, then you would hold back.
Okay. Now, to explain more on prostate cancer and when to get screened, we have a short video from the Centers for Disease Control and Prevention. Let's take a look.
In 2018, the United States Preventive Services Task Force, a group of health experts, concluded that men 55 to 69 benefit most from a prostate cancer screening test. You may have asked yourself, should I get screened for prostate cancer? The answer is, talk with your doctor, learn what's involved, then decide if prostate cancer testing is right for you. The main test measures blood levels for prostate-specific antigen, or PSA. Higher than normal PSA levels could mean that you have prostate cancer, or they could be high for other reasons, like an enlarged prostate, prostate infection, or taking certain medicines. If your PSA level is high, your doctor may ask you to repeat the test or recommend a biopsy, taking a tiny sample of prostate tissue to send to the lab to check for cancer. Ask your doctor about the possible benefits and harms of PSA testing. Benefits include knowing your PSA level. This can help your doctor determine your chance of having prostate cancer. Finding prostate cancer early may make treatment easier. And a PSA test may even save your life. Still, PSA tests may have negative consequences. For example, PSA levels are sometimes high when cancer isn't present. This is called a false positive and can result in unnecessary worry and additional tests. PSA testing can't always tell which prostate cancers are deadly and which ones won't cause problems. Most prostate cancers grow slowly, so treatment may not be needed right away and might do more harm than good. Your doctor may recommend active surveillance, which includes regular checkups and tests to see if the cancer grows, then treat it if it does. And prostate cancer treatment can cause serious side effects like impotence and loss of bladder control.
So they mentioned in that video, which is what I wanted to bring up, is that you can have a false positive as well.
And a false negative.
And a false
so it's
negative.
not a perfect test. And a large prostate will produce more PSA. So the prostate itself produces this prostate-specific antigen. If the prostate's inflamed because it has an infection, if the prostate is enlarged, if a man is ejaculated very close to their blood test, that's also going to inflame the prostate and increase the PSA.
Okay.
So it's not a perfect test, which is why we use that in combination with a rectal exam. And then based off of what we see there, we then make a determination as to who needs to proceed to the next steps, which is usually involves a prostate biopsy. We actually take little samples of the prostate.
And to learn more about prostate cancer, including symptoms and treatment, be sure to check out our video library on the Health Channel website.